For months, we've seen President Trump turn wearing a mask into a political issue. But now, as the United States nears the first coronavirus vaccinations, the question, will that resistance to wearing masks among Trump supporters translate to a reluctance to be vaccinated? CNN's Ellie Reeve visited a largely conservative county in Tennessee for this story.
News of imminent vaccines comes just as COVID-19 surges through rural parts of the country, and the political debate is as heated as ever.
And I don't wear a mask when I go in either.
We wanted to know if the same resistance to masks would happen to the vaccine. So we reached out to Greg Locke, a pastor in conservative Wilson County, Tennessee, who says he has grown his congregation by protesting COVID control measures.
We're not going to close our church, ladies and gentlemen, because of COVID-19.
There's a lot of sincere people that are doing their best to put out a vaccine, but that doesn't mean I'm going to take it. I don't believe the government can tell me, when or how I can stick a needle in my arm or my kid's arms. Super government overreach.
Locke says he's moved his services outdoors not to limit the spread of COVID, but to handle all the new people who've come.
Faith over fear. I ain't worried about some fake pandemic.
I'm saying the sickness is real. I'm saying the pandemic is not.
I don't understand what you mean when you say pandemic's not real.
Pandemic is not real.
But
That's
what do you
not
think
hard.
a pandemic is?
Not COVID-19.
But what
It is
do
no
you think a
pandemic.
pandemic is?
I think we stuck on the pandemic question.
It's
Well, then why
ridiculous.
can't you answer it?
I did. There's no pandemic.
But what
COVID-19
would
is not a pandemic.
But what is a pandemic then?
Not what we're experiencing. I'm 44 years old. We've not had one in my lifetime, so I don't know. And this is not it.
To be clear, a pandemic is a disease that spreads across many countries and affects many people. The World Health Organization declared COVID-19 a pandemic in March, and experts say about 70% of people need to get the vaccine to control COVID's spread.
It's not been tested enough. We don't know what's going to happen with it. Later on, it may help you now, but in the future, it can cause more harm to your body if you get it again.
It's not, this anti-vaccination, it's the devil. It's like, personally, it's a choice.
Some people at the service told us they'd seen Locke on Facebook and liked his message.
Donald Trump won the election by a landslide, and he will be reelected as the President of the United States.
We wanted to know how widespread his views are, so we drove deeper into Wilson County, where there's a COVID testing site at the fairgrounds. We met Quentin Smith, a cattle farmer who runs the agricultural center there and takes extra care to keep things sanitized during COVID.
Y'all will never go to a fairgrounds where anybody is proud of their bathrooms. I am. Come on in. I'm cautious about running out and doing anything. I think everybody's excited about there being a vaccine, but I think it's going to be kind of everybody waiting around and watching the first responders and the nursing home folks, and if there's any reaction to it. Everything here is completely clean. Let me tell you what my daddy always told me. Son, don't never believe anything you hear and only half what you see.
I think it's entirely human to be a little skeptical and a little hesitant. After all, this is a new virus in the human population. This vaccine uses new technology. It's been developed very rapidly, and that makes people cautious.
Based on our interviews and recent polling, Pastor Locke represents an outspoken minority. Surveys by the Pew Research Center found that Republicans are less likely than Democrats to see COVID as a major threat to public health, but also that there's a growing acceptance of the vaccine nationwide, including among Republicans. 60% of Americans say they'd take it, and nearly half of those who are reluctant say it's possible they'd get it after others do so. Dr. William Schaffner, who's been working on infectious disease at Vanderbilt University since the 60s, says that in order to overcome vaccine hesitancy, public health officials have to build trust.
You have to respect people. You have to respect where they're coming from, hear what they say, and then try to respond to their concerns.
We give shots to cows all the time, and you do get reactions to shots. So, we give a shot to an animal and it walk out there 20 feet out of the chute and drop dead. Everybody's going to respond differently.
After the first responders take it, when it's your turn, will you take the vaccine?
I probably will go on to take the vaccine.
How do you feel about the vaccine?
Anything new that has not been proven, I'm not sure I want to be the guinea pig, And I really wish there was time for more testing, but there's not. And we're losing too many people too fast, so we have got to do what we can. I know it's become a political issue at times, but it shouldn't be. This is a health issue.
The approach to COVID has had substantial political overtones. People have attitudes about this, and it will not be easy to change those attitudes.
Are you going to tell the members of your congregation not to get the vaccine?
Members of my congregation can do what they want to, but they'll watch my videos and know that I'm not getting it.
So you expect them to model your behavior?
I expect them to use their Bible and use their brain.
Ellie Reeve, CNN, Wilson County, Tennessee.